Hi, welcome to my channel. My name's Sean. I don't often do stuff like this, but I'm sure like a lot of you have come across this video, you've been diagnosed with a hernia or something of that nature and awaiting surgery. I've had surgery on a left inguinal hernia about 46 hours ago, and the thing that's been unique about my situation is I've also had a back problem for about 2 to 3 years. So I've noticed there's not a lot of stuff out there on YouTube for people with back trouble who've also got a hernia. So I know it's possibly related, and I'm hoping that when I recover from the surgery fully that my back situation improves. A little bit about myself. I used to be very sporty. I'm 54 years old now. I've just turned 54. And yeah, as I said, the last 3 years my back's been playing up and I've stopped doing a lot of stuff. I'm a web designer and graphic designer by trade. My YouTube channel is usually relating to my very bad guitar playing, but I've not been able to do a lot of that in the last few years, so hence the lack of new posts. But I just thought I'd create something in case it helps just one person, and share my experience of the operation and what I'm going through. As I say, it's currently day 2. As you see, I'm up and about. I'm currently in our garden office. My wife uses it she's a massage therapist, so this is our garden office. I'm come down here for a bit of peace and quiet because I've got family and there's builders next door and everything. So far, so good. It is very sore. I had surgery with a fantastic hospital in England here called Benenden. And I live in Kent, and they were fantastic. I've got to say, it's a private hospital and you can tell the difference. I love the NHS and it's a great institution, but as a member of the Benetton Health here, I just jumped at the chance. The waiting list for the NHS here was something like 50 weeks or so, and I was in a lot of agony. I don't know about your situation with your hernia, if you've got a hernia and watching this. Mine was excruciating. I ended up in A&E about 2 months ago, just tearing tissue, and actually the surgeon's report showed that I had tissue damage and inflammation on my tissue, so that explains that. The surgeon I had was fantastic, explained everything, explained the risks. If you're out there thinking about having surgery and a bit scared about it, I was too, to be honest. I didn't really sleep very well the night before my surgery. But the thought of living with the pain from the hernia anymore was just, unbearable. So on the day I was actually fine, and it's only the second surgery I've ever had. But it was fine, they knock you out, you don't know anything about it, and then you wake up and you have to deal with the discomfort. Like a lot of these videos that I watched pre-op, the worst thing, and it continues to be the case, is both getting up and down from a chair, sitting position, and also getting out of bed for the first day or so is an absolute nightmare. But you find a way, you find a way to get around it. You use your arms, you take away the use of your core a little bit, and you just adjust and you find a way. Don't worry about it. It's all fine. One of the things I would share with you, advice-wise, is get some walking poles or a walking stick. I've got these 2 walking poles, courtesy of my in-laws, who I borrowed them off, and I've got to say they've been a lifesaver, absolute lifesaver. It's enabled me to get around, not just be stuck in a chair or in a bed, which is the worst thing you can do. Yeah, it's been great. Another bit of advice is I've still got a huge amount of swelling around the incision. I had open surgery rather than laparoscopic, say on my left side, and yeah, it ballooned up massively. It's gone down a little bit now with the combination of ibuprofen and ice. It was scary to look at first. It looks like you look like John Hurt from Alien. Something's coming out, but don't worry about it. It's perfectly normal. I rang the hospital and said, like, is it normal to have a huge amount of swelling? He suggests it is. So, just talk to the nurses and talk to the hospital if that happens to you. But don't worry about it. It's actually a good thing, because swelling is where your body fills the air with fluid that repairs the damage. So I say mine's still there, but it's going down. I don't want to show you the wound like a lot of these videos do, because I think it's gross. Mine is particularly unattractive. Lots of bruising, again, which is a good sign. That means it's healing. I've got bruising in my testicles. I'm definitely not going to show you that because I think it'd be banned on YouTube. But yeah, I say it's only 46 hours, but I've not gone out yet, obviously, but I'm taking it easy. Part of the reason why my hernia was so painful was that because of my back problems, I was using a rehab trainer, lower back rehab trainer, and he got me on this 4-month core workout routine, and it was great. My strength was really improving, but unfortunately, while my back and core strength was improving, it was flaring up my hernia big time. So if you've got a hernia, I don't advise you working on doing core training, because yeah, that's why mine was so painful. If your hernia is non-symptomatic, you're lucky, and but I'd still get it sorted, because you know it will be fine. The operation's really quick. Mine was about 45 minutes to an hour, and before you know it, you're out of it, and it feels like you're worrying about nothing really. I mean, yes, the discomfort afterwards is significant, and it, you know, for a few days I'll be housebound. But my wife's been brilliant. You know, she's been feeding me soup and stuff, and I've just had a lovely lunch. I've still not been to the toilet for number 2 yet, which a lot of the anaesthetic, all these videos, they say, you know, you get clogged up, and I've still not gone, but I'm not feeling too bad because of it. I'm taking a laxative as well, which the hospital gave me, and I'm sure any time now it'll be all relieved. It's not painful in that way. The only trouble I get, as I say, is just getting up and down from sitting, and getting in and out of bed, but I'm not lying down at all until the evening, because it is a nightmare. You have to really find a way to not use your core. You don't realise how much through your core you use in everyday things. So I'm sort of waffling on a bit. I'll check in. I might do another video about 3 or 4 days after the op and say this is day 2. It's all good. It's healing. If you're worried about having the operation, don't. Just get it done, honestly. One of the quotes I saw that really made me feel confidence about having the operation was, in the hands of an experienced surgeon, this is a simple operation, and it's exactly what the consultant told me. For them, it's a bit of a doddle, but they've done so many. Do some research on your surgeon, no matter where you live, the US or UK or Europe. You can do that online now. My surgeon's had 5 stars all the way, and I had all confidence in him. Fantastic guy, and you know, once you've had surgery, you're kind of indebted to them. So yeah, don't worry about it. Get it done. It's uncomfortable, it's painful, but you'll get through it. And I'll check in again in a couple of days' time. All the best.